Using a tourniquet. Direct pressure almost always controls bleeding. If you are not able to stop bleeding with firm pressure over a wound on the arm or leg, and the bleeding is life-threatening, a tourniquet may be used to save the person's life. Tourniquets are a last resort for uncontrolled bleeding, where blood is rapidly soaking bandages or spurting or pooling on the ground. A tourniquet is only used on an arm or leg. Never use one on the head or trunk. It's important to protect yourself from exposure to blood with gloves or plastic bags to cover your hands, as well as eye protection. Wash blood off at the first opportunity. You need a few strips of cloth and a short, strong stick. Fold the cloth into a wide strip. Never place a tourniquet over a joint or over the wound itself. Instead, place it close to the wound and between the wound and the body. Wrap the cloth around the limb. Tie 2 knots and put the stick in the space between the 2 knots. Warn the injured person that this will feel painful. Turn the stick to tighten the tourniquet just until you do not feel a pulse. Then the bleeding will stop. Now tie the stick securely in place with another cloth. Tie a knot at the end of the stick. Bring the cloth around the limb several times. Then tie a second knot at the same end of the stick. Check again to be sure that you do not feel a pulse. Write the time the tourniquet was placed on the tourniquet or the patient's skin. Keep the tourniquet visible. Send the patient immediately to a hospital with surgery. When you arrive, show and tell the person receiving the patient that a tourniquet is in place. It needs to be removed by a skilled provider as soon as it is safe. Remember, place a tourniquet only for life-threatening bleeding on an arm or leg. Use a wide band and tighten it until you do not feel a pulse. Then tie it in place.